Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Luanne Sadueste. Luanne has been with Washington Hospital since 2003. She started out as a new graduate as a registered nurse working in the medical surgery floors at Washington Hospital. In 2010, Luanne received her master's degree in nursing administration at San Jose State University. Her certifications include Certified Neuroscience Registered Nurse, Critical Care Registered Nurse, Stroke Certified Registered Nurse, and Neurovascular Registered Nurse. Luanne currently is a stroke nurse and is part of the Rapid Response Team for Stroke here at Washington Hospital.
Tonight I'm going to talk about diabetes and stroke and exactly what is the connection between the two. So this is based on new current data. It just shows how diabetes is just rampant. There's an estimated 19.7 million Americans with physician-diagnosed diabetes. On top of that, there is an additional 8.2 million adults with undiagnosed diabetes. When I did my research, I was like 87.3 million adults. I had to check that several times because I thought that was an outrageous number, but 87.3 million adults actually have pre-diabetes. That means when you take your blood sugars, your fasting blood sugars are more than 100 and less than 126. Diabetes is a major risk factor for stroke. If you have diabetes, your chances of having a stroke is 1.8 to 6-fold risk. So the direct connection between diabetes and stroke is that it's vascular. It just does a lot of damage to your blood vessels. What happens in diabetes is that, when you eat, that glucose goes into your bloodstream, and then the pancreas makes the insulin that also goes into your bloodstream. But with type 2 diabetes, glucose stays in that bloodstream and creates damage, creates narrowing and blockages that can cause a stroke. Here's a picture of a normal artery as opposed to patient that can have diabetes and high prolonged blood sugars in the vessels that can cause this narrowing that you see here. And if you have that narrowing, you are definitely increased risk for having a stroke, or you're also at increased risk for having a heart attack. On top of that, diabetes costs an estimated $245 billion healthcare dollars. At least 65% of people with diabetes will die of some form of heart or blood vessel disease, as in stroke or heart attack. The good news is that you can minimize the negative effects of diabetes if you can achieve near normal blood glucose levels. You can do this with diet, exercise, and medications. The goal for your glucose would be before meals, 70 to 120, and then 2 hours after a meal is less than 160. So knowing all this information, knowing what the damage can cause with having high glucose levels all the time, why is it so hard for us to change our ways? Basically, change is difficult. We are all set in our ways. There are patterns in our life that defines us. There's some comfort and security in the life that we already know. Sometimes we don't even know that there's a different way. So motivation is often lacking. So tonight, we're going to talk about choices. I'm going to try to provide you some knowledge and some motivation and creativity to change. Change occurs with the understanding of what choices are out there and that's available to us. So did you know 80% of the time you can prevent yourself from getting a stroke? Strokes are 80% preventable. The 20% of it is, it's by controlling your risk factors. So 20% of the time, you cannot control these risk factors for having a stroke. As you age, anybody age 65 or older is at risk for having a stroke, and we can't change that. You can't change your gender. More men have more strokes than females, but more women die from a stroke. You can't change your hereditary, you can't change your race. Often strokes run in families, and African Americans have a disproportionate number of strokes as opposed to their white counterparts. Also, once you have a stroke or a TIA or a heart attack, you are at risk for having another stroke. Your body is already predisposed to having a stroke, so all of these risk factors that I mentioned you cannot change. But what you can change and can control is having diabetes and controlling your diabetes. Also, excessive body weight, stop smoking, excessive use of alcohol, controlling your high blood pressure, controlling what you eat and having a healthy diet, avoiding a sedentary lifestyle, and being stressed out. All of these factors you can change and you can prevent yourself from having a stroke. Also having the lack of knowledge of the disease process. This is other facts, and I thought this was surprising also. Only 20.7% of adults meet the federal guidelines of physical activity. Among high schoolers, 9th to 12th graders, only 37% meet the recommendations. When it comes to a healthy diet, less than 1% of adults meet the definition of the ideal healthy diet. And essentially no children meet this goal. When it comes to body mass index, overall, 68% of adults are overweight or obese. With children, 32% of children ages 2 to 19 are overweight or obese. So one of the most important interventions that you can make is weight reduction. Weight gain is directly related to many of the risk factors for stroke. It's directly related to having diabetes, high cholesterol, high blood pressure, poor diet, and inadequate diet. Therefore, losing weight may be the most important intervention you can make to avoid a stroke. Again, 65% of American adults are overweight or obese. So we really need to focus on weight loss and achieving a BMI of 18.5 to 24.5. We definitely need to limit our salt intake to less than 1.5 grams a day, eat small, regular meals, and increase your intake of fruits and vegetables to about 8 to 10 servings a day. The general guidelines for a healthy diet to avoid stroke, heart disease, diabetes, even cancer. Generally, you just want to increase your fruit and vegetable intake, decrease your red meat intake, have about 2 servings of fish a week, reduce the fat in your diet, particularly saturated fat, reduce your simple sugars and carbohydrates, anything that increases or gives you that spike in your blood sugars, increase your complex carbohydrates, and also increase natural unprocessed foods. Other healthy tips is to keep plenty of healthy snacks around, like bananas and apples and carrot sticks. Don't eat anything standing up. If you eat something standing up, you probably don't need to eat it. Join a Weight Watchers group, learn about healthy foods, join a healthy cooking class, learn to read labels, read. There's just so much information out there. A soda a day. Soda. I have nothing good to say about soda. Soda is so bad for you. In 1 can of soda, there's about 39 grams of sugar. 39 grams. That's about 10 teaspoons. So if you drink a can of soda, this is how much sugar you're drinking. Now, would any of you actually drink this much, sugar at one, setting? It's a lot of sugar. And knowing that sugar, it also increases your chances of getting coronary heart disease by 20%. Now that's a significant risk. Even a moderate amount is having just 1 soda a day increases your chances of getting heart disease by 20%. Research didn't show anything when it comes to diet soda. However, diet soda is associated with weight gain and metabolic disease that was shown in previous studies. The problem with diet soda is its high intensity to the sweet taste. Water is probably the best thing to drink. Even fruit juice, it's not a very good alternative because of the sugar-sweetened drinks, which is associated with increased triglycerides. Cutting the consumption of soda is probably one of the easiest behavior you can change. I even grew up drinking soda. It's just so embedded in our culture. It's easily accessible, it's relatively cheap, but it just does so much damage to your body. You also want to avoid a sedentary lifestyle. The American Stroke Association recommends at least 30 minutes of aerobic exercise every day. Exercise helps you lose weight. It helps you improve your cholesterol levels. It reduces stress and lowers your blood pressure. So some healthy tips to avoiding a sedentary lifestyle is that after having dinner, go for a walk. Don't be a couch potato. Don't socialize in a bar. Meet your friends at the gym instead. Learn new leisure activities like cycling, tennis, golf, or swimming. Remember, when you get strong and lose weight, you also can look great. So there is a huge lack of knowledge of what a stroke is. 39% of stroke patients and 27% of public respondents could not even name one risk factor for stroke. 2/3 of those respondents couldn't even name one single warning sign, and a lot of them were not even aware of what organ was involved when you have a stroke. So the signs and symptoms of a stroke is anything that happens suddenly. Any sudden numbness, weakness, especially in the face, arm, or your leg, especially when it's in one side of the body. Any sudden confusion, trouble talking, trouble speaking, any sudden trouble seeing in one or both eyes, trouble walking, dizziness or loss of balance, or sudden severe unusual headache. These are all the signs and symptoms of a stroke. So what exactly is a stroke? A stroke occurs when an artery of the brain becomes blocked or ruptured and disrupts the blood supply to that portion of the brain. Brain tissue can die and be injured, causing change to neurological function. So is stroke a healthcare problem today in the United States? Why, yes, there are about 795 strokes a year. Stroke is the fourth leading cause of death. One person dies of a stroke every 3 minutes. Stroke is the #1 leading cause of serious long-term disability. And there are more than 5 million stroke survivors. Stroke is also the biggest user of healthcare dollars, about $65.5 billion a year. Now there's different types of stroke. One of them is an ischemic stroke. This happens when a blood clot develops and blocks some of the circulation to the brain. This blockage stops circulation downstream and starves the brain tissue of oxygen and nutrients. The result of that is brain tissue dies and brain damage occurs. This is a picture of the brain. As you can see, it's highly vascular. And what happens is that there can be a clot or narrowing to one part of the brain, and that part of the brain that's not receiving any blood supply or oxygen. Another type of stroke is a hemorrhagic stroke. Blood vessel in the brain ruptures and blood leaks out into brain tissue, causing pressure and swelling. The result of that is death of the brain tissue and brain damage. Now, there are several causes of a hemorrhagic stroke. A lot of times it's from hypertensive bleeds. You can also have aneurysm, which is ballooning of the weakening region of the blood vessel, or our arterial venous malformation, which is basically a cluster of abnormal blood vessels. So there's a picture of a weakened blood vessel, and what can happen is that blood can fill the space inside the brain. What can happen with an aneurysm is there's a weakening in the blood vessel, and it creates a little outpouching, and that aneurysm can rupture and go into the subarachnoid space of the brain. When considering all the strokes, a lot of times, 87% of the times it's an ischemic event. 13% of the time it's hemorrhagic. TIA. TIAs, or transient ischemic attacks, are warning signs of an impending stroke. They occur when blood flow through the brain artery is blocked or reduced for a short time. TIA's symptoms are temporarily, but similar to those of a full-fledged stroke. A person who experiences a TIA is 9.5 times more likely to have a stroke. So there's the Cincinnati pre-hospital stroke scale, and these are the 3 signs to test for a stroke. We often look for facial droop, arm drift, or speech. When it comes to facial droop, you can ask the person to smile or show me your teeth. Normal is when both sides of the face move equally. Abnormal is when one side of the face does not move as well as the other side. So there's a picture of a right facial droop. Arm drift, you can do this by asking the person to hold up their arms, extend it, and have them close their eyes for about 10 seconds. Normal is if they don't move their arms at all while their eyes are closed. Even if they move both at the same time, that's still normal. Abnormal is when one arm drifts while the other one is not drifting. So there is a picture of a drift on the right arm. And then speech, you can ask the person to repeat, "The sky is blue" in Cincinnati. So normal is when the patient or person says it correctly with no slurring of the words. Abnormal is when you hear slurred speech or you hear the wrong words or they're unable to speak. So what do you do if you suspect a stroke? You call 911. Stroke is an emergency. It's a brain attack. Much like a heart attack where the clot went to your heart, this time it's a brain attack. That clot has gone up to your brain and it's time to call 911. Time loss is brain loss. Each minute that is delayed after having a stroke, you lose about 2 million brain cells every minute. So the best thing to do is just to call 911. What can be done for an acute stroke is that these patients may be a candidate for what we call TPA, or tissue plasminogen activator. It requires a rapid, coordinated response. IV TPA can only be given when the patient or person was last seen normal within 3 hours of when they were last seen normal. For a very limited population, it can go up to 4.5 hours. So the expected response is 60 minutes from door to needle. So what we have learned about stroke so far is that stroke is a major killer and disabler. It can be detected early and it is treatable. Time is critical when it comes to stroke, and it is an emergency. So if you suspect someone is having a stroke, please call 911. Prevention is probably one of the most important goals, especially when it comes to diabetes. You want to see your doctor regularly, take your medications as ordered, take your own glucose at home and keep a record of it, keep your weight down, exercise regularly, eat right, and stop smoking. If you have diabetes, take classes. Diabetes is a very complex disease that you must become an expert at managing in conjunction with your doctor. There's a lot of resources out there. I had gestational diabetes, and thank goodness for the programs that they had out here at Washington Hospital, the Sweet Success program, where they had me talk to the diabetic educator and a nutritionist. But whatever it's diabetes, you need to just become an expert at it. Keep coming to the classes. There's also stroke community classes every first Tuesday of the month. They're all free classes. And that's it. Thank you.